Welcome to the PHAB Center for Innovation 21st Century Learning Community Interview Series. I'm your host, Rena Chedgar. In each video, we hear from public health leaders about their work and what they've learned. Today, we talk with leaders from the Public Health Accreditation Board, or PHAB, to learn about PHAB's commitment to transform public health across the United States. Joining me today are Paul Kuehnert, President and CEO, and McClaire, Senior Vice President of Program Operations. Thank you both so much for being here today. Paul, can you describe PHAB's mission and role in the work to advance and transform public health?
So at PHAB, we champion performance improvement, strong infrastructure, and innovation in governmental public health departments. We do that work in partnership with many others. So the departments that we're working with directly from different levels of government, as well as national partners and funders like CDC, Robert Wood Johnson Foundation, and so on. And so what we do concretely is offer programs and professional services to health departments, both individually and on a system level, to include national public health accreditation, national recognition with our Pathways program. We have a whole set of tools for transformation, and we provide technical assistance, learning community facilitation, and training.
What do you think are the biggest challenges facing public health today?
So I think the number one challenge that's facing public health right now is the issue of trust. So the trust issue comes up because really the pandemic was such a traumatic event, both for the public health workforce, for the healthcare workforce, and for the communities that we serve. So many losses were experienced by everyone throughout this pandemic. And then on top of it, there was this incredible disinformation and misinformation campaign going on from a variety of bad actors that really undermined people's faith in and trust in science, and folks like public health workers that depend on science to do our work day in and day out. So I think the biggest issue that we have right now in public health is the issue of trust. And we have to find ways to lean into this issue with our communities, to re-engage with our communities, and to find ways to restore confidence in our public health workforce and to build that trust back through active dialogue, good communications, and really the kind of accountability and transparency that accreditation can provide.
PHAB believes one approach to public health transformation is through a statewide systems approach. Megan, turning to you for this question, what does this mean in practice?
A state-based system approach acknowledges states' critical role in driving local public health oversight, resource allocation, policy development, and partnerships. It recognizes that each state is unique and public health transformation looks different across each state, and it's tailored to meet the specific needs of the community served. The process of transformation starts with developing a clear vision of what public health should look like when the state ensures improved health outcomes for all of its residents. It adopts the Foundational Public Health Services, or FPHS, framework that outlines governmental public health services that every community should have access to, ensuring that no one is left behind. States can assess the cost and capacity required to implement FPHS framework and evaluate their resources and identify areas where additional investment may be needed. Transformation also needs sustainable funding, and states can explore various funding mechanisms to ensure resources are distributed according to community needs. And with the groundwork laid, states can test and transform practices and innovations across various aspects of public health, from workforce development to data collection and service sharing. And in building knowledge and skills and capacity is also essential for successful transformation. This means investing in training and professional development opportunities that ensure the public health workforce is equipped to address the diverse needs of their communities.
How is PHAB involved in this work?
PHAB is committed to supporting state-based health systems, and we acknowledge the unique context of that work. The partnership landscape will look different depending on where you live, and it may include your SACHOs, your health departments, your health systems, tribal nations, public health associations, or the academic field at large. We work to facilitate support and guidance to states that are focused on system-wide transformation through our 21st century learning community, and we hope to highlight and disseminate insights on promising practices for the broader public health field. We offer state-based cohorts for our Pathways Recognition Program, which is tailored to provide capacity building support for quality improvement efforts and to strengthen the infrastructure for local health departments. And we continue to explore statewide opportunities that streamline and incentivize accreditation among local health departments.
If there's one thing you want people to know about a statewide systems approach, what would it be?
PHAB is here to support states as they explore ways to advance public health transformation that is tailored to the needs and the context of its system and local partners. Transformation is not an overnight process. It requires intentional thinking about how this can be done to create the change that ultimately improves health, well-being, and equity for all, and that is an iterative process. We know that it takes strategic effort, coordination, and time, and we want to help. The steps you take today and the steps we can take together will strengthen the system for future generations.
As we wrap up, Paul, what would public health look like if a statewide systems approach were adopted across the country and we're successful in advancing transformation efforts?
Well, I think fundamentally what we would want to see is that the foundational public health services are available to everyone, everywhere, in all the communities. Secondly, we would make sure that we have a diverse, skilled, and adequate workforce that is able to meet the needs of the communities that are being served. Again, a third key piece is that the system is equitable, that it's addressing in a systematic way, making sure that all community members are served and that the systems are set up in such a way that they're modern, they're resourced, and they're prepared for both emergencies and for the day-to-day issues that communities face. And then finally, that we have the flexible and sustainable funding that really is going to be there to support our communities and address their health needs long term.
Thank you both for being with us today. You can visit the show notes for more information on PHAB's resources to aid in developing a statewide systems approach to transformation and other tools for transformation. On behalf of everyone at the PHAB Center for Innovation, thank you for watching.